obviously a Cuban immigrant. I was born in Cuba, and my parents brought me here. I do believe in the capitalism system. However, there are three things that should never be privatized. Everything else, have fun, enjoy, make your money. Healthcare, prisons, and education. Because we've seen what happens when these things are privatized. We've seen what happens with healthcare. It doesn't work. The private system does not work.
Obamacare is definitely covering more people, right? But it has its drawbacks. Where in that system do you think we're seeing the problems that need to be addressed or need to be fixed?
Well, like I said a little bit ago, because it is a for-profit, where insurance companies do determine what states they go, which exchanges they participate in, and what premiums they charged. When they initially started, yes, everyone wanted to get in, so they were competing. They made their premiums, relatively reasonable. Plus, we had the Medicaid expansion for people between the 100 and 133% of the poverty level. But being in Florida, our governor chose not to take that expansion. So we have about almost, I think, 800,000 people or so in Florida who are eligible for Obamacare, subsidized, because they cannot afford to be on regular Obamacare because it's based on your family income. They're not poor enough to be on Medicaid, but they're not rich enough to have the Obamacare subsidy. So they get cut out because of the Medicaid expansion that our governor, Rick Scott, refuses to take in this state and in many other Republican states. And that's one of the drawbacks. So the insurance companies are doing pretty much what they did before Obamacare started, which is they're increasing their premiums, they're going crazy with their policies, and at least they can't, okay, a couple of good things about Obamacare. They cannot discriminate you if you're a woman, which they did before. They charged you more premiums. They cannot hold pre-existing conditions against you. And if anyone who has signed up for Obamacare knows, even for employer subsidized insurance, they don't ask you if you're sick or if you have any conditions anymore. They don't ask you that. You can keep your child up to the age of 26 on your premium. What else? Yes, you can get subsidized. But the biggest thing really is pre-existing conditions and the Medicaid expansion. Now, if we repeal Obamacare, all this goes away. So what do? I haven't heard a replace plan yet. We go back to what we had before. So kids are no longer covered. Everything that I said is gone. It's repealed. And that's wrong. So rather than repeal it, we need to fix it. How can we fix it? Well, let's put back the public option. That's one perfect example. The public option was initially in there in 2010, but had to be taken out because it wouldn't have passed, even though all the houses were Democratic. There were still enough people there who would not have passed it. So the public option was taken out. I am pretty sure that if people are given a choice between, for example, Medicare, which is so cost efficient compared to private insurance, and private insurance, that if enough people pick Medicare, we will run out the insurance companies and we will make it a government system, which is the best. People are happy with their Medicare. People who have Medicare are happy with it. The problem is, yes, that is also going up in premiums. Why? Because, again, we have big pharma. Yes, and I am a doctor, but I don't think that big pharma should be charging as much money as they charge for medications. For example, the EpiPen debacle that was discussed a few weeks ago, where the CEO, they increased the price, I think 6 or 7-fold. It was ridiculous. It was like $100 and it went up to $600 for 2. Now, if you have an EpiPen, you need it because you're severely allergic to something. So what people were doing who were able to, they were either ordering it from Canada, which is actually kind of illegal because it's not packaged the same, or they were driving to Canada and buying it if they lived close enough. Inhalers is another example. You can get a generic inhaler in Canada for $2. Here you're paying $50. Why? Why can't insurance companies and the government negotiate with big pharma to bring down the costs? Okay, so if we have one fish in the sea, one payer, they have to settle for, there is no negotiations, because you're going to have all the different pharmacy companies coming and saying, okay, we have this drug that's equivalent to this drug, that's equivalent to this drug. We'll give you this price, we'll give you, and they'll start competing against each other for low instead of for high. Now it works the other way. And then some companies who have branded drugs, they are the only ones who offer this. So what we do is we find alternatives. That's what we do now with generics. That's what I do here at this clinic. If I can't give branded medications, so I give something that's equivalent or just as good in a generic version that the clinic ends up paying for, or I will give a shout out to Publix, because they do give one diabetic medication, two hypertensive medications, and like 4 or 5 antibiotics completely free to anyone, whether you have insurance or not. And that's why I'd like to shout out to them, because I think that that's an excellent alternative to people who don't have insurance. Now all they have to do is pay for the cost of the visit, or most of what they do is go to the ER. And then we pay for the cost of their visit. That's what people don't realize, that when you don't have insurance, how are they going to bill you? And if you don't have a home, they can't find you. So insurance companies and hospitals are not going to take a loss. So the rest of us pay premiums that are higher because we're paying for the uninsured, just like we do in car insurance, in homeowners insurance. That's what insurance is. We pay for people that need it, right? And then our premiums go up if too many people use it. That's how it works. My name is Dr. Alina Valdes, and I'm running for Congress, District 25. Please visit my website, Alina Valdes with an S for Congress.com.